Hi guys, Shannon Gonto here, professional counselor in Louisville, Kentucky. I am here today with Amanda Townsell. She's a licensed professional clinical counselor with NAPOP Counseling. She does individual counseling with teens and adults to help them heal and increase their coping skills and their overall support systems. She works with individuals struggling with anxiety and self-esteem and those of the LGBTQ plus community, among many others. So if you want to learn more about her, just go ahead and contact her through her Therapy Den profile. You can just simply visit therapyden.com, type in her name, Amanda Townsell. Her profile will pop up, and it's a super easy to navigate website where you can just go ahead and message her and get in contact with her to learn more about her services. But thanks, Amanda, for being with us today and answering this question for us. The question we have for you today, though, is how can I find a therapist who is kind of a friendly kind of advocate to the LGBTQ plus community?
Yeah, and thanks for having me. I'm excited to be here. So, I think any time that someone is searching for a therapist, it's stressful, can be very anxiety producing. But I think particularly if you're a person who's in, the LGBTQIA community, you want to make sure that you're finding someone who is going to be affirming and supportive. And so, online places are a good starting point. So, like Therapy Den, it's very easy to look on there. Psychology Today, I know, has certain filters that will have you where you can look for people who are specializing in LGBTQ plus issues.
Mhm.
And then I think they even have some breakout ones for certain specialties that you're looking for. Another way is just to ask people that you know who maybe have been to therapy, who they have went to that they've enjoyed or trusted. And most therapists, especially during the pandemic, have it set up so that you can reach out to them via email. And you can always ask for a free consultation. So a lot of therapists will do a short phone call, it can be 5 to 30 minutes long. I think it varies a lot from clinician to clinician, but you can ask them those sorts of questions. And I think you can tell a lot from how different clinicians answer those questions, if it would be a good fit for you, and if it's someone who is going to be able to support you with what specific things you need help with.
Mm-hmm. Yeah, to kind of to pick up on those, even just like human to human vibes of like how you feel in that 5 or 15 minutes talking to someone, and it may not even be about kind of the population that you identify with, but just in regards to, yeah, like you said, like how those responses and the conversation flows between that, and if you feel comfortable as a client talking about those things to essentially a stranger on the other end of the phone, but that's how the relationship starts.
Absolutely. And I think, for me personally, I've been doing lots more consultations since the pandemic started because I just think that having that before your first session just helps reduce the anxiety, but it also allows both of you to ask questions, express concerns. And even though it's only, on average, I would say my consultation calls are 15 minutes, you can learn so much information in 15 minutes.
Mm-hmm. Yeah, yeah, definitely. Yeah, and kind of thinking about kind of specifics to the LGBTQ plus community, like I guess, are there certain things to like look out for? Like, can any therapist work with this community? I suppose.
So other clinicians might disagree with me on my opinion of this, but I don't think that any therapist can. I think that therapists can do the work to be able to be a good provider for folks that are in the LGBTQ plus community. But I think that there's a lot of different factors. So, one, sometimes therapists' own religious or personal beliefs are maybe not supportive or affirming. And I think that sometimes clinicians feel like they can kind of approach a client with a neutral position, and that is still allowing them to provide adequate services. But for someone who's in the LGBTQ plus community who's already facing so much discrimination and may not have a lot of affirming folks in their life, to have a clinician who's in that neutral position, who's not affirming for them, who's not supportive, and who's not able to really understand all of the different barriers or discriminations that they're facing, I don't feel like is giving them the best services that you could get.
Mhm.
Um, I also think a lot of training programs, I mean, my own graduate school program did not give adequate training on addressing issues within the LGBTQ plus community or how to navigate that. And that's something that I still see sometimes that therapists struggle with, even with language around pronouns and using, non-binary pronouns, that sometimes that's a thing that's very challenging. And there's this intersection for folks who are non-binary or trans of their mental health is directly impacted by people using their pronouns. And so if you as the mental health provider are not able to use the correct pronouns, or that's something that you're uncomfortable with, I don't feel like that's going to be a good fit for someone.
Mhm. Yeah. And kind of for, and I guess speaking for myself, but not speaking for all clinicians, but like that's our responsibility to do the work to be able to, of course, build that relationship within the clinical sense, but also like do the education on our end and get the trainings and get the exposure and challenge our own, whether they be beliefs or whatever it may be. But like, yeah, a lot of us, like, yeah, bike ride program, I think we had like a chapter on different things, like same for like racial, like we had a chapter on each, and it's like, really does a chapter like condense everything into like, no. So like post grad had to do a lot of training and education, and like a lot of professions, there's a lifelong learning space on there, but like we should all be doing that. And from a client's point of view, it says nothing about you if your clinician is not doing that or is not in a space for that. And that's kind of where you can take your advocacy rights to find another therapist who would be affirming or who would kind of fit those vibes a little bit better to keep your safety in mind.
Absolutely. And, for licensure purposes, we're required to have certain things like suicide risk assessment and domestic violence training, but we are just not at a point where it's a requirement to have training on working with LGBTQ plus folks. And I really do think it is on the clinician to sign up for those trainings, to do that research, to stay up to date on what is the appropriate like word choices for certain things.
Mm-hmm.
What are the new information coming through from mental health agencies on what's the best practice for working with folks who are LGBTQ plus? And for making sure that you're making space for your client. One of the complaints that sometimes I have heard from people is that they go into a therapy session, they sit down with the clinician, and then the clinician doesn't understand like a significant amount of terms that they're using, and they spend the bulk of their therapy session giving education to the therapist that they're paying to see.
Sure. Yeah. Yeah. Which there's I think everything lives on a spectrum, but there's kind of times where we can do that to share our experience with someone. But if it's kind of taking up a good bulk of the time, being able to check back in, and like in any situation, not just in regards to this population, it's kind of like breaking up with your therapist or whatever it may be, but remembering that like these are your sessions for you, and to go back to maybe therapy dinner, those directories, and use those filters to find a therapist that may be more affirming, or sometimes like your own therapist or mental health Lou or reaching out to you, or like other things, or like reach out to us or you or whoever, and like other therapists are going to be able to help you find someone who may be a better fit for you. Because kind of when you spoke to the consultations a lot earlier, sometimes I do consultations with people and they're not going to be the most, the best fitting client for me. So I would send them somewhere else, because these sessions are for the client and kind of need to meet their needs best. And yeah.
Absolutely. And I mean, I do that too sometimes, even just for scheduling purposes. Like, depending on where my caseload is, if I don't have space, like, I have 5 to 6 other practitioners that I can refer people out to that I know are good and that are competent. And there are specific clinicians that I know, hey, these are their specialty areas and they're really good in this thing. I feel comfortable saying you could go to them, and you're going to at least be respected. You're going to have that consultation piece, and they're going to let you know if it's not a good fit.
Yeah. Yeah. Oh, I like all of this information. I don't know, anything else you want to leave our community with before kind of logging off for today?
Um, just like there's a resource that I personally share with lots of folks, and I think it's one that it's a very cost-effective book, but it's called A Quick and Easy Guide to They Them Pronouns.
Okay.
And it's sort of written instead of like a graphic novel type thing, but it's written by a cis male and then a non-binary person who really break down the complexity of why it's so important to use the correct pronouns for folks. And sometimes this is a good book to recommend for families or coworkers for someone, but also I think it's just a good, quick, easy read for clinicians who maybe that's a particular area that they're struggling with.
Yeah. And can you just hold that up one more time on the screen?
Of course.
Perfect. They, them pronouns. Quick and easy guide. I like it. Very cool. Well, thank you so much, Amanda. Guys, remember, if you want to learn more about her practice, it's Maypop Counseling. You can find her on Therapy Den. Also, social media, right? Is there? Do you have?
Yeah.
Yep.
Yeah.
Okay. Yep. So honestly, just Google Google her name or Google Maypop Counseling. Things will pop up. And of course, if you guys have a question for us to get answered by a professional in the field, just DM us and we will do that. But until next time, be safe and thank you.
Thank you.